My name is Kemet Amon Lewis, and I'm from St. Croix in the U.S. Virgin Islands. I'm a marine scientist, and I was going to be in the water a lot. Kemet, before last summer, was a very independent person. I'm not entirely sure where the exact start of all of this was when the infection started. It eventually developed into sepsis.
He was so critically ill. He came by air ambulance.
He was admitted into our flagship hospital, our level 1 trauma center.
He had multi-organ system failure as a result of the septic shock. He had to be on these pressors, as we call them, that divert blood from the extremities to your vital organs in order to keep you alive. Unfortunately, he wound up having severe injury to these extremities that culminated in him having to have amputations. I am absolutely sure that he would have lost his life.
We have a team of global operations, which is 24/7, 365 program out of the Patient Logistics Center. So that helps us have a window of acceptance of 30 minutes to an hour tops. So in Kemet's case, that was life-saving. This case brought to life the reason that we moved our global operation into the most technologically advanced part of our hospital system. Today, one call does it all. We also work very, very closely with international insurances all throughout the world, so we're able to provide a quick turnaround from a financial perspective.
I stay in constant communication with the family so that they can feel comfortable that we are taking the best care of their loved ones.
One of the things that we pride ourselves on is the fact that the patient experience extends outside the walls of our facilities into our community.
We consider it just part of our quality and part of our DNA.
As his patient journey progressed, he was actually admitted into our inpatient rehab institute at Broward Health North.
It was tough at the beginning. There were some not so fun days.
It's always difficult with multiple limbs to try to rehab and be able to gain a sense of independence. You almost have to create a program at first for the first 3 months, and then when the prosthetics are fitted and put back on, you create an entirely new program.
The prosthetic tools have helped me do and be more.
When Kemet looks at what his future looks like, it has to do with the services and the level of care that he received at the Rehab Institute.
With a motivated patient, the sky's the limit. You know, we create disability and patients create ability.
The team at Broward Health were very supportive, gave me all of the tools that I needed.
I am extremely proud of what we did with Kemet. He has literally walked out of here with his kidneys not being on dialysis, his heart with absolutely no damage, his lungs are fully functioning, and it's just fantastic.
Dr. Hamilton, I love her with all my heart, and the team of nurses and doctors that were with me. I live on my own. I cook for myself. I am determined to do and to be. There's a lot of things that worked out exactly how they needed to work out for me to be here today.
Our one-on-one concierge customer service is at the heart and soul of what we do here at Broward Health.
The other conversations we had were the doctors reaffirming me that I was going to be back in the water, I was going to be back on the tennis court, I would be back in the dance studio at one point in time.
We're with the patient every step of the way.